Welcome to our podcast, the Healthcare Success Podcast. I'm the host, Stewart Gandolf, and today I'm interviewing Michael Baer. Michael, welcome.
Thank you, Stuart. Good to be here.
Good. So Michael reached out to us, or I met Michael, I should say, through a mutual client, where Michael was the fractional CMO, and I felt like we developed a relationship since that period of time. And oftentimes, our agency comes across people where, or companies that feel like they need marketing firepower, but they don't really have internally the right people, and they're not ready to hire full-time CMO. And so we've developed a relationship where we try to refer to Michael when we can because, or refer Michael in when we can because, a lot of times our clients need help. So anyway, welcome, Michael. Michael, actually, I'd like to start by just asking you, it's really funny, the term fractional chief marketing officer. Back right around the early 2000s, I was doing that role. I actually was vice president of three different companies for marketing on a
Hmm.
part-time basis. The word fractional CMO wasn't out there then. Tell me a little bit about CMOs and what's going on these days.
Well, it's interesting. I think you point out something funny, which most people don't realize that the idea and the term of a fractional CMO has been around for a while. And yet it does seem to be an idea whose time has come
Yeah.
for a lot of reasons. I think, we've got various socioeconomic factors that are constraining budgets and keeping people maybe from deciding to hire full time. Uh, we've also had this post COVID effect where the idea of hiring remotely and hiring talent wherever it is completely accepted, widely accepted. And I think we also have a lot of early stage growth companies, that are coming up in various industries. We'll talk, I know, in a bit about the healthcare and kind of healthcare aligned uh, boom in terms of new company development and growth. And those are the types of companies that are very open to, in fact, normally seek some sort of fractional or temporary solutions across lots of their functions in those early stages. So I think there's a lot of reasons why fractional is growing. I just read some data yesterday that something like the growth in those roles. I'm not sure if it was postings or people claiming to have those roles was up 60% last year over the year before, 60.
Wow.
And probably the year before that was another 60 or 70. So yeah, it is kind of a faddish term. In fact, it's interesting. I chose when I went to a consulting. So I spent about a decade as a embedded CMO at a variety of companies. And when I left, I began consulting. I decided to join a full consulting company. So I work for a company called Tech CXO. And one of the reasons I did that is because I always am a contrarian and I hate like new terms for stuff that just describe something that's always been around. I hate
Yep.
growth marketer and what the hell is marketing supposed to do? But oh God forbid you grow. We need a new term for it, growth market. Like there's certain
Yeah.
terms. So I kind of reject fractional as the term of the moment. And so I joined this company that we've been around for 22 years. So uh, while it may be some faddish term, I guess at least I was part of the I'm part of the company that maybe launched it 22 years ago.
That's great.
And so we have 125 partners across the C-suite. So maybe you're aware of fractional CMOs, but there are fractional CFOs, fractional CTOs, fractional chief operating officers, et cetera. We even have CHROs.
For sure. Well, let's talk about your background is in healthcare, med tech, you've worked with providers as a strategist. Tell us a little bit more about, I guess where you are today with the kinds of clients you're working on, and then we can segue to the whole idea of stratecution. I'd love to have just a quick thumbnail sketch of
Sure, sure. Yeah. So I spent 25 years ish in advertising, running big strategic accounts, consumer accounts, uh, big global businesses, and kind of cut my teeth on that real, positioning strategy, uh, you know, rigorous foundation of those kinds of businesses. I'm going to talk about it a little bit in a bit when I talk about stratecution, but I spent a lot of years with Unilever, who are noted as like really formal strategic marketers. And then I pivoted to B2B CMO roles, as I mentioned before. And the last one was like a $200 million healthcare media company. And it really was my first full-on healthcare role. And I loved it, and there was something about it. There was a lot about it. When I left it, I knew I wanted to stay focused on healthcare, and there was a lot about it that I found really rewarding and appealing. One is, I mean, no matter what you're selling and working on in healthcare, at the end of the day, there's a patient having their health affected, and for the good. And I do think that rubs off on all of us working on that business. Obviously, Stewart, you've been in this world for a long time. I do feel like there's something a little bit better than selling Coca-Cola when you're helping an oncology company do X, Y, or Z, or even if you're helping a technology company minimize administrative burden for doctors in a setting. All of these things do have some sort of good associated to it. And I think that was one of the things that drove me deeper into it. And then the other thing was COVID, and post-COVID, there's been such a I think anybody in healthcare would admit that up until COVID, the healthcare industry at large was a laggard in terms of innovation, in digitization, in being quote customer centric, in leveraging all the advances that have happened in so many other spaces, like on demand and remote access and all those kinds of things that we take as kind of table stakes in almost every other category. I think healthcare was delayed for some good reasons. There's lots of compliance and regulatory issues, but on others, it's just not the way we do things. And I think COVID was a real shock to the system, where okay, a lot of things that we do, we send out salespeople to the streets, and they go to the they go into practices and deliver pizzas and all these things. That this is how we go to market. This is how we commercialize a product. How we do clinical trial. Everything the way we did anything, we can't do it that way now. And so the kinds of companies I've been working with, it's interesting. My practice, as it were, has somewhat bifurcated. The typical ICP of a fractional C-suite, CXO, C-suite executive does tend to be that kind of early stage growth company. I like to say they've gotten somewhere. So maybe it's seed investment, maybe some sales, maybe the founder and whoever have created some sort of revenue. And even if it could be 5 to 10 million, but they know that what got them here is not going to get them to 2x, 5x, 10x. And they recognize a few things. And this is one of the things we may talk about as well. They have to sort of recognize these things. They have to recognize, one, that they likely need to professionalize how they go to market, make some more systemic and programmatic changes to the way they look, feel, talk, interact, engage with the market. And two, they also recognize that probably they've been doing everything. So whether it's founder, COO, whoever is doing, well, I'm doing marketing sort of as a side venture. I'm doing sales as a side venture. They have to also recognize that they're probably not the best person to be doing that, both because they may not have those specific skills, but even more importantly, their time is more valuable doing the things they are good at. And so they have to kind of recognize that. But so, those are the kinds of companies, and I've worked with health tech, digital health, telehealth companies, companies that have technology or services or some combination that they sell to practices for practice management. I've worked in workflow solutions, provider side work. But the other side of my practice has been a series of literally almost 4 years now, or over 4 years now, of work with doing marketing strategy and marketing, even some implementation and content marketing for GE Healthcare and their ultrasound. So I've got the ultrasound division. So I've got this kind of like the, 0 to 15 to $20 million set of businesses and this $25 billion global company to compare to with the work I've been doing for the last 4 years.
Sorry. Good. Let's talk about stratecution. What does that mean, and why is it a critical lens for healthcare companies to adopt?
So Stewart is mentioning a concept I came up with, I don't know, 15 years ago or so, that I termed stratecution. And as you can imagine from the name, it's kind of obviously dumb, simple. It's a combination of strategy and execution, and you need to have those two together. And they're two sides of the same coin that need to, kind of work in tandem. And that's, I think, you get a lot of head nods. Oh, of course, of course. When I launched this idea, it was interesting. I was actually still in the agency world, and I'd been working with companies like Unilever. And what I found was, at least in, with some of the, the projects I was working on with Unilever, we would spend a year developing the strategy for some sort of launch. We do, deep dives and quantitative research and concept testing and ideations, and then we'd get quantitative validation of a concept of the strategy, and then we would develop a big idea, like a creative idea that took some sort of lateral leap from that strategy, and it would be a big idea, and then of course we'd test that as well. And we're a year into this, and we have a big idea, and and what I would see is, at that point, they would almost think, okay, we've done it. Now it's just we get to the execution, as if execution is the weaker part that just doesn't take any effort. And I like to think it's like, they think that it's a snowball. Like, we've got the big idea, we've got the strategy and the big idea. All you need to do is just push it down the hill, and it's just going to get bigger and grow and everything. And what I realized is, no, I mean, the execution, first of all, is, if you have a brilliant strategy and execute poorly, you're going to fail. But if you have a mediocre strategy but you execute flawlessly, you'll probably succeed at some level. And so I realized that's, thinking about like the execution almost as sort of, it's just the arms and legs just running along, and it's really the big brains do the strategy. I thought was really a poor way to look at it. But on top of it, as you get into the digital world, all the execution needs to be strategic. How do we do these things? How should we follow up? What are the touch points? I mean, all these decisions, like it, we went from a world, you and I both, Stuart, started when, you really had TV ads and radio ads and print ads. I mean, digital wasn't even a part of our initial palette. So it kind of was, I suppose, easier. But once you got into a digital world, there were so many decisions that needed to make to lead to success. And so I called it stratecution. You needed to be strategic execution. So I was working. So in other words, I was working on projects that had some strategy, or even a lot of strategy, but not enough strategic execution. What's interesting is, in the world that I am in today, it comes almost from the other side. There's almost a flip on the idea of stratecution, and I think it comes from this, I believe, overly mythologized Silicon Valley kind of ethos of, move fast and break things, or fail fast and, succeed faster, which I just think is kind of the wrong way to think about things, because it leads people to just start doing stuff without a strategy. So a lot of times I will go into companies or talk to companies that really don't have strategy. They won't say they don't have strategy, but they don't have strategy, meaning they haven't formalized the strategic components that help your execution. And they will, in fact, just start doing ads, creating social media posts, right, doing videos. They'll build their website, and they really haven't formalized who is their customer, what are their needs, how do they shop this category, what are their pain points, what is our value proposition, what's the messaging, how do we think, so like none of that stuff's been done. So in a way, we're just executing without the strat now. So that's what I find is almost always missing. And this is why one of the things I say is it's almost never too early to start marketing. Naturally, there's a cost and a budget necessity at times that have you not maybe hire me or someone like me. But in terms of when is marketing, I mean, marketing is as fundamental as anything at early stages, because marketing is really, I dumb it down to, it's understanding what your customer needs in a way to frame not just your product, but how you communicate your product so that it's solving a customer's needs. That's part of the strategy work that needs to be done. And if you haven't done that work, I have to believe that your product probably doesn't exactly deliver on the needs of your customer, let alone your actual content or messaging.
So it's interesting. A lot of times I go back to when we're doing marketing for clients. I start off with, okay, five, four piece, five piece, seven piece. I find that everybody goes straight to promotion, like amateurs do it all the time. They're talking about ads in the first minute or two. And it's like, wait, what are we doing? Who's our target? What's our strategy? What's our competitors like? What's our unique messaging? What's our value proposition? What is our price, place, product promotion, people, positioning, and packaging, right? Like what are all these things? Because everybody jumps to the ads. And I think we talked offline a little bit. Is that where you feel people are going wrong? It's just jumping straight today, the opposite problem, instead of spending all their time on strategy.
Yeah,
Now they're just spending
yeah,
all their time on tactical execution.
absolutely. That is one of the biggest things. They immediately say they immediately jump to tactics and action. And I think, like I said, part of it I think is this idea of like just starting to, and also it's both this ethos of like we'll iterate, like put some ads out or build your website, and finally the internet will tell us what's right, which to me is such a silly waste. I can't imagine doing it that way. I like to say it's sort of like, can you imagine getting in your car and starting to drive without knowing where you're going? Like you may end up where you wanted to go, but you're going to burn a lot of gas and waste a lot of time. And that's to me what just starting to do ads and expecting some algorithm to performance marketing algorithm to get it right. But I also think there's this crazy drive towards action in the startup world. Like we just need to start doing things. So I think people, when you want to get to action, your action doesn't, it feels counterintuitive to start acting by thinking. You know what I mean? I think that there's this belief that like doing strategy is like a luxury. Like oh, that's time intensive, and I'm not going to. It's keeping me from doing and acting. And what I always tell people is that actually taking a moment. And by the way, I'm not like Unilever 1988, where we would take a year to do strategy. I mean, we could be unbelievably, scrappily nimble. But I always say spending a minute or two thinking and then formalizing our strategy, we will go so much faster, and we will avoid so many missed missteps and wrong turns, and it will end up being incredibly efficient. Even if it's, let's just spend 2 weeks to actually write down who is our customer. Let's write down, the various, maybe just some basic stages of some sort of path to purchase, because we know in most of these areas you and I work, people aren't buying on the first time they see you. It's not like a knee-jerk impulse buy. This is generally something that takes a number of touches, might involve the sales force, etc. So these are things that I should be thinking about, and putting some rules down. It doesn't mean they're in cement and we can't iterate, but it's important to, like, again, like getting in a car, like it's so important to know which direction you're going. And one of the things I find a lot is that because there isn't anything written, there isn't anything foundational, strategic foundations aren't in place. You're also reacting to everything, in these companies, that like any inbound lead or anybody, it's because it's not, oh, this is who our customer is. And while somebody else who doesn't look like that might buy us, going after them will take our eye off the strategy, and we'll end up going down a different rabbit hole that could lead to maybe one small sale, but is not a good use of our time. And that's the other thing I always say is that while budgets are in scant supply in early stage companies, your time and attention is almost more valuable. There's only so many people working at these companies, and there's only so many hours that they can work a day. And so wasting time is as sad and bad of a situation as wasting dollars. And I think they forget that sometimes. So like spinning out on unstrategic efforts and tactics that aren't, well, at least aligned with the direction you want to go, is a real drain.
So, can you think of um, just to make this more real and less theoretical, perhaps, a case study that of, a client you came in where they either jumped to one or the other, and because by the way, I could see how that happens today. If you've been brought up in digital marketing, and like, let's say your background is like largely pay per click, you try something that works or doesn't, and you try it again, you iterate, and so the difference is like back pre-digital, to do a new TV commercial might be $50,000, $500,000, and it either works or doesn't. It takes months. Whereas, paid digital can move really quickly. So I can see
Right.
why that happens. But any interesting anecdotes? I'd like to have that to kind of bring it.
Yeah. Yeah. Well, so like, for example, so one of the companies I worked for um, was similar to the one that you and I overlapped on, in that it was offering telehealth therapy, provider. So we had a provider who, had, clinically credentialed provider in a specific area, um, covered fee for service, similar to the one we were working on. This was actually in diabetes education that I'm talking about. And initially there was some, when I came in, they hadn't done any marketing, but there was some um, momentum amongst the founder and some of the folks to do direct to consumer advertising, meaning the consumer could raise their hand and say, I want this therapy. It was likely to be covered. It was 100% covered by Medicare and Medicaid in its region, and they were ready to consider doing that. And I said, first of all, if we did get consumers coming in, we'd have to validate their insurance. We'd have to go through some hoops. Again, very lean team, but also we'd only be converting one person. Whereas if we instead spend our effort going to drive referrals from doctors, so endocrinologists and or family care practitioners, GPs, and also those are the people who patients tend to listen to their doctors more than D2C commercials or ads or things. So that was a thing where I went in and said, this strategy may not be the best strategy, and let's define who really our best opportunity. Because you could chase, I've talked to a lot of companies. I haven't gone in, to some of these conversations I have are at the early stage. One was, a company had developed a product in the dental space, and they were like, we're going to sell to this. I can't remember. I think they were trying to sell to employers. No, actually, first they were going to have a location and have people come to them, and we're going to drive people there. It's like, that's not right. That doesn't make sense. And then it was like, let's sell to the dentists themselves. That we've got a remote. This is one of the issues. I know you didn't ask this here, but this is one of the issues I see of A, not having a strategy, but B, even more often I see this, and I'd be interested in if you do as well. There are early stage companies sometimes that are products that are built seeking a problem to solve. You
Right.
know what I mean? It's like sometimes it's like I came up with this good idea. We built a product, but there really isn't a go-to-market strategy where the product fits the market need. There isn't really a need. In fact, I was talking to a company the other day. This leader, this founder, had come up with this idea, born out of a personal issue she'd had, and built the product, and then was trying to find who the buyer would be. And it was like, well, I could see how you'd sell it to the buyer, but the end user has never demonstrated a need for it. So it's either selling in a completely new behavior, trying to teach a new behavior. Like, you know what I mean? Like sometimes there's
Good
just
luck with
you
that, by
have,
the way.
and that happens in this category where you've got engineers, you've got biochemists, you've got people, really smart people who come up with a concept, but at the end of the day, there's the commercial aspect of any product requires an understanding of customer need and also incentive, right? I mean, who's going to pay for it? I mean, and again, we know this, and probably everybody listening to your podcast knows this, that healthcare is a very interesting, complex, and perhaps unique category where often you're selling to a user who has a patient who works for a company the payer is somebody else. I mean, it's who is incentivized to pay it. And there's a lot of new products coming up, new companies coming up in areas like proactive health or how to help keep people healthy, like terms that you hear a lot about, but there's really no one incentivized to pay you for that.
It's really a good point. It's funny. I was just thinking as you were talking, some of the cases that I see, like right now, where early stages of working with a medical device and the memory care, and then you have a whole series of strategies you can do for consumer direct, but then there's also B2B, and those are really, and with the early stage, you don't know which way it's going to go. So, like where the real pay is going to be, and then yeah, the other part you just mentioned is in healthcare, you need to figure out reimbursement drives everything. Reimbursement
Yeah.
drives everything. And so anything that has to do with required things, it's going to be reimbursement. And then the also we've worked with companies, for example, in the value-based care arena, where just one of the companies that's out there is called Homeward, and they tried a little bit with on the consumer direct, but then also to the health plans because they're trying to keep people out of the hospital. And then another company I was talking to yesterday actually is in the mobile health and same kind of thing. Like, who's the customer? Who's going to pay for it? Start there. Like, before you spend a lot of time developing something, make sure you can sell it because you could waste a lot
Yeah.
and a lot of money and a lot of resources creating a perfect product that nobody wants to buy. And in fact, I remember my first days, it may have been my first day of class when I stumbled into marketing as a lark, learning about the idea of the marketing concept is don't build a product and find people to sell it, build a product that people want to buy. It's like the very first thing I learned in marketing class.
Yeah.
Where it's
Yeah.
like,
Well,
some
yeah.
people
Yeah.
skip that
Exactly.
stuff. Yeah. And creating a market you can do, but it's just really hard. Let's pivot a little bit and talk about your role to the fractional CMO. I'm always intrigued about the kinds of companies you work with. So like what is like sort of the sweet spot of, when does a fractional CMO make sense for a company to consider and when do they really need a full-time person or something else? I'd love to hear your thoughts on that.
I mean, as any kind of big, broad question, it depends.
Yeah.
It's diverse answer, but
Well, to
I
make it
think
more
it's
real for somebody, and like maybe it's just again some examples of
yeah, a
people
couple
who work for.
examples. Yeah.
Yeah.
Yeah. So I have gone in and been the first marketer at a company that had gotten pre-seed funding and had 150,000, $200,000 worth of revenue, but really had just begun. And so I was the first one. And I think that that's one of the places, I don't know if everybody's good at that, but one of the kind of spaces that I am good is I created the foundational strategic pieces and then the brand pieces as well, and then built the brand. And the brand is, 7, 8 times that now. It's still in very early growth stage, but um, so doing that work, who is the customer? Because again, it could have been, oh, we're going to sell. In fact, as you can imagine, the very first rough website I always see, we're, for you got to, for patients, for doctors, for health plans, for employees. Everybody thinks that they have a solution for all of them, and we really focus. In fact, the first thing I did there, which was I think interesting and also kind of counterintuitive, but the best start we had was the only marketing I began doing was to current patients. You think, well, why? They're already captive. Well, because we found that there was leakage, a lot of leakage in the amount of sessions they could take. So we weren't maximizing current, quote, lifetime value. We also had very soft conversion scores. So we'd get a hold of these patients before they literally became patients, when they were referred to us, and only, whatever, I think it was something like 15 or 10 to 15% did actually convert. And by beginning to communicate to them, we 6 or 7 times that. So, doing the foundational strategic bits. What should we start with? Who's our customer? How are we going to grow? What are the, all those pieces. So that was like an example of like really early stage. But there was, of course, a budget for me, and that's what I hear a lot is yeah, I'd like to do that, but I don't have a budget for you. But I've also gone in, for example, here was an example at sort of the other side of investment, where it was a company that was bought by private equity. It had been around for 20 years and had been rolled into, or they'd purchased 3 or 4 other companies almost the same size. So the total company was now about $80 million. But they didn't ever have a CMO, and they didn't, they did some marketing, but like it was an old website and it didn't tell the right story. And again, these 4 companies now were together and they all had somewhat of a different story. And so they had a lot of smart people, but they didn't have anybody focused on this issue. So I came in and I did a typical, a lot of engagements will start with a typical kind of consulting assessment. So I went in for a month and I said, here are the key things I'm seeing across these aspects. Here are the implications and my recommendations and priorities. And then I wrote the strategy. Here's your positioning story. Here's how to go to market. Here's a marketing plan. And I actually ended up bringing in contractors to start doing that work. And then I made myself obsolete and I went off 6 months after. But so it's kind of like, here's like a $80 million company that's already gotten lots of places, but they are in a new, they almost needed to kind of reboot themselves. So generally it's a company, and usually the common refrain is, we have stuff, but we've mostly cobbled it, done it scrappily. So we've got a website, maybe we've got, some content marketing or some LinkedIn, but we really haven't formalized it. We really haven't created some sort of enduring, systematic approach to going to market. Probably we're doing a lot of cold outbound sales, but we haven't kind of integrated sales and marketing. So there's a cadence of, we know who these people are. We're going to have a nurture plan. We're going to provide tools to the salespeople to reach back out, so they're not saying in their email, trying to get another meeting, just reaching out. So, those things that take you from one-off email blast followed by a bunch of phone calls into a more cadence of, this is how we're going to go to market. Kind of thing, and like, anything in between. And then, of course, like I said, I've also do strategy work for bigger companies. And so, for example, with GE Healthcare, I've done everything from, I do a lot of provider insights. I've done a lot of, research and strategy work with the users of the ultrasound, or even as well the economic buyers in hospitals, and writing, strategic platforms for products and launches and things. You know, to sell into providers, to sell into hospitals, to sell into economic buyers, and that's kind of a different set of work.
One last question I'd like to ask you, because we work, I think both you and I work in various verticals, right? We work with device, SaaS, telehealth, but on the provider side in particular is a place where, and I don't know if you do too much work there, but a lot of times, for example, we worked with a big multi-location dermatology business, and they had a CEO. It was kind of that stage where um, the doctors still are not running day to day, but they still get a vote, right? And so the CEO had no marketing person at all. And so it's hard because on our side as an agency, we love talking to the CEO, but someone's got to do stuff. And someone's got to be able to
Yeah.
corral the owners and the board and all those things. Is that a common frequent thing that you see where do you get involved with providers at all? Because for example, addiction, and we see that. So it depends on like, other kinds of companies. And again, we work with all kinds. We're from VC back to whatever, but I'm just curious in that particular vertical. Have you seen what?
I mean, I haven't done a lot of work for big provider groups. This telehealth diabetes education company is a provider, but we spend our effort marketing towards HCPs to drive referrals versus trying to get patients to know about us. Um, but I think that's a kind of a common thing in many categories, which is, depending on size, but normally up until a certain size, like CEO will just try to run everything and maybe put in a junior marketer. Not just you, Stewart, but I talk to a lot of other um, agencies and consultancies, and often they'll tell me, God, I wish there was a you, meaning me, in there to help one interpret what the CEO really is looking for, understand the business, and then help give us the direction, and versus us trying to work directly with the CEO. I think that's one of the things you're saying, and yeah, I see that in
Actually, that's a good
other
way of putting
areas
it because
too.
we've seen that. We've seen, so maybe it's not the provider base, but that's, maybe the main point today, I think, is that there are companies that, when they're just starting out, there's no room for a CMO. When they're, thriving, they've got many different things. There's like if the CMO's role is probably over, but it's that stage where, yeah, a lot of times, businesses in healthcare, some of them are very consumer driven, marketing driven, but a lot aren't, So for example, going back to dermatology in many markets, there's a waiting list. So they don't perceive a need for marketing at all. Or at least
Mm,
some people don't. And so it tends to be a stepchild, not really understood what the power is, the value is. And so, if you're working with a CEO who has no time to do anything, that's difficult. Or if you're, sort of, I call it I stole this line years ago from someone, kick to the kids table, where you're working with a very junior person who's, may or may not even have much esteem internally, can't get anything done. And there's just a huge disconnect. So I think in those categories, that's where a CMO, fractional CMO could make a lot of sense, coming in and translating between the various levels of the CEO and, somebody at a very low level or doesn't even exist to help the marketing get forward underway. Any last comments on that? Because I definitely agree. That's when we're looking for. Because there are times where, we love that particular practice and that business, but it is difficult if there's no one to throw the ball to. And so, we
no, no, for sure.
times
Yeah,
will
of
say we act as the outsourced marketing department for
course.
business, but I still need a contact internally. We can't do it all.
Yeah, no, 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 no question that I see, and often when I'm the CMO, I bring in whoever I bring in. I consider my internal marketing resources, whether they're individual contractors or agencies or little agencies. So if when I won't even say if when we work together, Stuart, I will
Yeah.
hope I will expect that we will act like we're, brethren within the company.
Yeah, I think
Um,
so. I think so. It's really important to have that kind of relationship, and it's been fun working with you until now. But as we go forward, there are times for sure where we need that. Um, so great. Any last words of wisdom or advice of what to do or what not to do?
no, I mean, I think that, when a company, when the CEO is ready to say, I shouldn't be doing this marketing bit, and also is ready to really listen and take input from consultants across the mix, but for the better of their business, it's a great plus. It's a great multiplier, and I'd love to hear from anybody listening. If you want to chat, send me
Great.
an email at michael.baer, Baer, at techcxo.com. And I'm looking forward to working with you as well, Stewart.
Very good. Thank you, Michael. I appreciate it.
Thank you.